All right. What we did in this research project is we looked at patients that had known pulmonary pathologies, and we utilized the Biodex balance unit and put them on the unit and obtained what their scores were, and then compared those scores to what the normalized values were. And as you can see in the graph, that their scores were dramatically more outside what the norms were for what we would consider normalized values. And then what we did too is we had the patients complete standardized forms that are normally used for these patients, and we compared the results of these instruments with the values obtained for the Biodex scores, and we found that there were no comparisons. In other words, the instruments did not appropriately identify individuals with pulmonary pathologies as having balance deficits. What we'd like to do in the future is take patients that have pulmonary pathologies, utilize the Biodex, and then compare those results with the Berg balance, the Tinetti, the timed up and go, more of the standardized assessments, hands-on assessments that we can do in the clinic to see what kind of correlation that we have with those types of tests with the Biodex. And I guess that was it. We would like to also increase the numbers. The other thing too is if we can continue to see abnormal values of patients with pulmonary pathologies, we would like to get some type of standardized norms for patients that have pulmonary pathologies. So in the future when patients do come in, we can see where they fall in relationship to other patients that have pulmonary pathologies.
So a quick word for conclusion, please.
Sure. We need to have more definitive line of questioning for our patients that have pulmonary pathologies so we can help identify our at-risk patients. We also need to have more appropriate and greater objective tests for our patients with pulmonary pathologies. Any patient that comes into our clinic that has pulmonary pathology, they need to be assessed for balance deficits, given what we found with the Biodex results. Obviously, we don't want them to fall, and given the fact that they have all these comorbidities associated with them, we don't need any broken hips or anything like that as well.
Thank you very much.
You bet.